Simon, good morning.
Hello.
Okay, what I'd like to do this morning, if it would be okay with you, is to do an examination of your chest and in particular have a listen to your heart, if that would be all right with you.
That's fine.
Okay, so we'll be doing some looking and some feeling and then having a closer listen with the stethoscope.
Fine.
Okay, I'm just going to put my hand on to start with, just to make sure everything's nice and clean. And while I'm doing that, I'm just having a general look at you, sort of up and down, just to check everything is okay. Right, now I'd like to just take a close look at your hands, if that would be all right. It's lovely and warm. A bit of a closer look at your nails. Looks all right. I'm going to just have a feel of one of your fingers. I'm going to squeeze your finger for a few seconds. That's lovely. What I'd like you to do now for me is, could you just make like an M shape with your fingers like that for me, so I can see if there's a gap in the middle? Yep, there most certainly is. Lovely, just relax back down. I'm going to feel your pulse now, if that's all right. So I'm just going to count that for a few seconds. And I would do that for 30 seconds. Check the rate's normal, and I'm going to feel and see if it's the same on the other side as well, which it is. And I'm also going to feel the pulse in the inside of your elbows, if that would be okay, for a few seconds. That's good. And then I would also do a blood pressure on both sides. So that's done the parts of your arms. So I would like to have a look at your face now. Could you just take your glasses off for me for a moment? And if I could just get you to just pull down your lower eyelids, so I can have a look. That looks good, nice and pink. Everything looks fine there. Okay, we'll look around here. Just pop your eyes shut for a moment for me. Okay, thank you very much. Have a little look in your mouth, if that would be okay. Just open your mouth. I'm just going to have a look with a torch at your mouth and also at your teeth. Okay, both. Lovely. Thank you very much. I'm going to have a slightly closer look at the ears. That one and that one. They all look fine. So that's looked at all the things I need to look at on your face. I'm going to have a bit of a close look at your neck now, if that would be all right. Okay. I'm going to have a feel of the pulse in your neck to begin with. So if you just relax, I'm just going to just feel my fingers on your neck, one side and then the other. Let's do it on the other side. That seems fine, thank you. What I'd like to do now is have a bit of a closer look at the vein in this part of your neck here. If you just like to pop your head slightly to the left, I'll just check your position. I think you're at about a 45-degree angle, so I think that will be fine. I'm just going to shine a light, a torch just on your neck a bit more closely, just to see if I can see the pulsation that I'm looking for here. Oh yes, and I can see that nicely, just about there. Okay, let me put that down there. Right, so what I'd like to do now is have a close look at your chest. If you could just pop the blanket down to your waist, that would be great, and then I can have a look. Okay, I'm just having a close look just for a minute, just to look at how everything is. And have a bit of a close look at this part of your chest just around here. Just put my eye down to have a close look. I'm just going to have a feel at this part of your chest as well. Okay, that's all right. Now what I'd like to do is I'm going to feel more generally over your chest, and I'm going to see if anything's tender or uncomfortable when I press on your chest with my hand. So just let me know if anything's tender or uncomfortable at all. Is that all right? Anything sore? Anything tender?
That's fine.
Just going to have another feel of your chest now, a slightly different way around, just to feel for any vibrations in the chest that can sometimes give us clues about what's going on. So I'm just going to put my hand on your chest there and move it in a couple more positions. And then just there. Thank you very much. So now what I'd like to do is I'd like to have a listen to your chest with the stethoscope. I'm also going to have a quick listen to your neck as well. I need to listen in quite a lot of places with both sides of the stethoscope, so it will take me a while to do it. Okay. So that's not to say there's anything wrong, it's just because it does take a bit of time. So just relax and I'll be as quick as I can. I'm going to start by having a little listen to your neck, so just relax and I'll listen on both sides. Just hold your breath for me for a second. Breathe away. Hold your breath for me for a second again. And then breathe away. Just going to listen on your chest now, some different positions. Do that again with the other side of the stethoscope. If you'd just like to roll for me slightly onto your left side, that would be really helpful. Just one more listen here. Again, this is quite a routine thing to do. Okay, and then lastly for this part of the examination, if I can just get you to sit forwards for me, that would be great. So I'm just going to have one more listen at the front of the chest. If I could just get you to hold your breath for me for a second. Just take a breath and then hold again. Okay, that's lovely. Are you comfortable in that position?
I am.
If I just do something at your back. Right, what I'd like to do at your back is then just, I'm just going to have a little tap on your back just to see if I can find the bases of your lungs.
Okay.
And then have a listen to the base of your lungs when I've done that. So just feel a little bit of tapping on your back to begin with. I'm just going to have another little listen to your back. If you could just breathe in and out normally through your mouth for me, and just if you feel at all dizzy, just wave your hand at me.
Okay.
Thank you very much. That's good. I have just have one more look down here actually. That's okay. And then if you could just work your way back onto the pillows and relax back just so we can complete the examination. So just have one little look at your tummy before you pop the cover up. That all looks okay. So I'm going to pop that there now. And just to finish off, I just need to have a look at your feet and your ankles. Would that be all right? Okay, so we would do a femoral pulse, but we won't do one of those today. And we could also do a popliteal, but they're hard to feel. So the main ones we focus on are the ones in the feet. So I'm going to have a feel at the pulses in your feet, Simon, and your ankles. So I'm going to feel on your foot here first. And then have a feel inside your ankles. And on the other side. And just have a little look at your ankles, see if there's any sign of swelling at all, which there isn't. Okay, I'll pop those back down for you to make you more comfortable. And that completes the examination. I've had a look at everything today. Nothing that I found abnormal at all to be concerned about. Okay, we'll see you shortly. Thank you
very much.